Hey guys, it's Professor Sears. We're going to go ahead and go through the health assessment part 2, check off the head to toe. I am just in my basement here, so we'll do the best we can. But we'll go through this. It'll give you an idea of what they're looking for each step and how to do some of these skills. So we'll try to go through the whole thing start to finish without me kind of pausing to teach too much. I will show you your cranial nerves. We will also do how to test the major and minor joints, and I'll show you a few options. And we'll go from here. All right, so first thing, I'd be knock, knock, knock. Hi, can I come in? Acknowledge my patient. So, hi, Mr. Jones. My name is Sarah. I'm going to be the nurse taking care of you today. I'd like to do a quick assessment, listen to your lungs, your heart, your stomach. It'll probably take me about 20 minutes. Would that be okay right now? And he says yes. Great, so I wash my hands when I come in. I'm going to close the curtain, provide privacy. Mr. Jones, can I see your armband? Can you say your name and date of birth for me? I check and they match. Do you have any allergies to anything? No allergies. All right, Mr. Jones, on a scale from 0 to 10, if 0 is no pain, 10 is the worst pain imaginable, how would you rate any pain that you have right now? If he says 0, I'm done. If he says, oh, I have 3 out of 10 pain to my ankle, then I go into PQRST. So what palliates it, provokes it? What makes it better? What makes it worse? Is it radiating anywhere? The severity we did. PQRS and T is timing. So when did it start hurting? How long is it hurting for? All right, so no pain for him. So moving on to the next part, general appearance. I'm looking at my patient. His age appears consistent with his chronological age. I don't see any signs of acute distress, meaning there's no increased work of breathing. I'm looking at his facial expression. It appears calm, appropriate for the situation. His mood and affect are also calm and appropriate. His speech is clear. His dress is appropriate to the situation and the season. And he does appear to have good personal hygiene. I'm going to go ahead and ask some questions here. Can you say your name for me? Mr. Jones, can you tell me where you are right now? And he tells me he's in the doctor's office for a checkup. And what's today's date? And then why are you here today? And if he answers all of those right, then I would say he's alert because he's awake, and oriented times 4 because we asked the 4 questions. All right, I'm looking. I don't see any visible devices, no canes, no walkers, no hearing aids, no prosthesis. All right, the next part, we could do a set of vital signs. I'm not going to today, but if your teacher needs you to do them, then please do your vital signs. Next, we're going to move on to skin and nails. So I'm inspecting the skin. I'm looking at the skin color. Is it pink or within normal limits for ethnicity? I don't see any lesions, wounds, rashes, incisions. I don't see any piercings on my patient. I'm palpating the skin temperature using the back of my hand, the dorsal part. The skin temperature is warm. I'm going to go ahead and check skin turgor, so I can pinch on, I usually do like an arm, so you can pinch skin turgor and it should briskly go back down, okay? So he has brisk skin turgor or elastic skin turgor, good recoil. All right, the next part I'm looking at the nails. So I'm looking at the nail bed here at the color, which is pink. The shape is rounded. And then the contour, that's where I look for clubbing and I say, okay, put your fingers like this for me. I'm looking for profile sign. Put them together. If I can see that little window, that means there's no clubbing present. Okay, the next part, we are looking for capillary refill. So I'm going to push down on their fingernail and blanch it, and at brisk capillary refill it returned within 1 second. All right, the next part I'm moving on to the face. So I'm looking at the face, at the symmetry of the face. It does look symmetrical. I'm going to inspect and palpate the head. So I'm literally palpating the head. I don't see any lesions, and looking through the hair, I can kind of section it and move it and look between. I don't see any signs of infestations. All right, the next part, we're going to start cranial nerve testing. So cranial nerve 5, this is my trigeminal nerve. I can palpate here and ask my patient to open and close their jaw. If they can do that, it is intact. I also want to check sensory function. So what I could do, I don't have one here, but I take a cotton-tipped applicator and I have the patient close their eyes and tell me where I'm touching them. So I'm going to do forehead, cheek, and jaw. So, okay, tell me where you feel it. And you would say right forehead. Okay, how about now? Chin, right cheek, left cheek, left forehead. Okay, so just with the soft side, just to see if they can sense where they're being touched. The next one is cranial nerve 7. This is facial. We're assessing motor function. So I need to ask them to make some faces for me. So I can ask them to close their eyes, hold them closed tight, don't let me open, raise your eyebrows up, show me your teeth, puff out your cheeks, and smile. And if they can do that, their motor function is intact. All right, the next one is cranial nerve 11. So I would, facing my patient, put some pressure on his shoulders and ask him to shrug his shoulders up against resistance. And then I would put my hand here and ask him to turn his face and push, and the other side. So basically it looks like this. I'm pushing against it, resisting, and that is intact. All right, I can also look here at my trachea. So I'm looking, the trachea is midline on my patient. Moving on to the next section, looking at the eyes. So just looking generally at the external ocular structures, I'm looking to see if there's any discharge, any redness, any lesions. Ironically enough, I have a black tear duct right now. So if you look right here, this is a little bit of redness, and you could perhaps call that a lesion. I want to go ahead, I'm looking at the eyebrows, eyelids, eyelashes. I don't see any lesions, no signs of infestation. And then I want to go ahead and assess the patient's eyes. So I'm going to shine a pen light if you want to, or you can just look for this part. So I'm looking at the conjunctiva, should be pink. The sclera is the white part, should be white. So conjunctiva is pink, sclera is white. Now I can do pupils, so I'm going to shine my light. I'm looking to see if it constricts. So we're shining the light. I don't know how well you can see it. That's okay. So do both eyes. I'm looking at the size. So using the gauge on your pen light, I don't have one here, but I'm holding it up and going, oh, that one looks like 3 millimeters. And that one's also 3 millimeters. So they are round, equal because they're 3 millimeters. Reactive to light, and the last one is accommodation. So I ask my patient, can you look at the back wall far away, and then look at my pen light up close. So look far away, look at my pen light up close. Your eyes do two things. They converge towards midline, right? But the pupil also constricts. So pupils equal, round, reactive to light, and accommodate. The next thing I want to do is test his cranial nerves. You can use your pen light, you can use your finger. I usually just use my finger, but I'd be looking at my patient. Finger is about 12 inches away, and I tell him, I want you to keep your head still, but follow my finger with your eyes. So this is the one where I'm making the pattern this way. To the side, down, up, side, down. So if you were testing me with this one, I usually tell him, look right here at my finger, and follow with your eyes. You do want to move it far enough that they have to look all the way across. This is testing the cardinal fields of gaze or extraocular movements. These are cranial nerves 3, 4, and 6, oculomotor, trochlear, and abducens. The next section is ears. So I'm just looking at the external part here. I don't see any lesions. My patient doesn't have any piercings. I'm going to go ahead and look in the meatus. You need a pen light to look in here. So I'm looking in the external auditory meatus. I don't see any discharge, no swelling, no redness. And then I'm going to do the whispered voice test. So this is one, I'm going to have my patient occlude their ear by pushing in on the tragus. I stand 2 feet behind the patient, okay, directly behind, and I'm going to whisper 3 random letters or numbers. So I could say XK2, and they go XK2. And then we cover the other side, so patient covers their ear. And then I could say 3-4-D, and the patient says 3-4-D. So they got 6 out of 6 correct, so they passed the whispered voice test. They need to get at least 4 to pass. The next part we're going to look at, the nose. So I'm looking at the patient's nose. Do I see any lesions on it? Is it symmetrical, just looking at the outside, and any signs of inflammation? No. The next part I want to assess is patency. So I ask my patient to occlude one nostril. So he occludes one nostril, he breathes in. If you can hear them breathing, it's patent. Then do the other side, breathe in. Okay, great. So bilateral patency is present. I'm also assessing for drainage when I look, right? So I can look up with my pen light. Okay, I don't see any signs of drainage. I'm sorry, the second part I misspoke. Deformity, asymmetry, inflammation. We are actually looking inside the nose for this part. Of course, with COVID times, please leave your mask on if that's what they ask you to do. All right, the next part we're going to look at are mouth and throat. So I'm inspecting the lips. I'm looking at the color and are they moist? So I'm looking at my patient's lips. They are pink and moist. I'm inspecting the tongue. It is pink and moist. You can have your patient go, ah. I'm also inspecting the gums. So go like this. You can use a tongue blade to pull down if you need to. They are pink and moist. Buccal mucosa is the cheek, like here on the side. It's also pink and moist. The palate, the roof of the mouth, is pink and moist. And then I'm inspecting the teeth. They look to be white, aligned, and straight. They aren't missing any. And the pharynx. So this is the part, this also assesses cranial nerve 9. So I have you open, ah, and you should be able to see the uvularized midline with phonation. Another one we can do, and then looking at the pharynx as well. Pharynx, no redness, no drainage. So assessing cranial nerves 9 and 10, we can have the patient swallow. If they're able to swallow, then cranial nerves 9 and 10 are intact. The next one is cranial nerve 12. So you can do one of two things. You can have your patient say light, tight, dynamite, and if the speech is clear, cranial nerve 12 is intact, or ask them to stick out their tongue. So protrude your tongue. It should be midline, and that means cranial nerve 12 is intact. Moving on to the next part here, I'm inspecting the anterior chest. I don't see any accessory muscle use. I'm going to go ahead and listen to my patient's lungs. I'm going to do this just so I don't hurt my ears. I'm not actually going to put them in, but put yours in your ears, please. Make sure that these little pieces here, they point forward towards your nose. So I'm going to go ahead and listen to 4 to 6 positions in a side-to-side pattern. So I'm going to start here. Remember your patient's right and left. So this is the right upper lobe, left upper lobe, left upper lobe, left upper lobe, right middle lobe, and then you can listen either like down here or you can go kind of lateral for the right lower lobe, and then one more. Okay, good. So we did the front. Now we're going to go ahead and start moving around towards the back. So as I'm looking, I'm going to look at my patient from the side to see if there's any kyphosis or lordosis, like sway back. And then I can look as well from the back. This isn't the full test yet, but I'm just kind of looking to see, can I see any scoliosis, sideways curvature of the spine? I'm also looking to see, is the anterior to posterior diameter less than the transverse diameter? If it is, that's a good thing. That means they do not have barrel chest. The last thing I want to do is listen to my posterior lung sounds. So remember, C7 prominence is where the top of those lungs start. Don't listen over the spine or the scapula. So can't listen here. You kind of got this one little line right in here. This is my patient's left side. So this is left upper lobe, right upper lobe. You only have a little bit of space to get the upper lobe, so the rest is lower. So down here, this would be a right lower lobe, left lower lobe, and then you can just pick a couple more. Right lower lobe, left lower lobe. Tell me what your findings are. So we're all lung fields clear, lung sounds clear, no adventitious breath sounds. Tell me whatever it is you hear, and do that for the front as well. Next is cardiovascular. So I want to go ahead and check their pulses. So I've got to check a carotid pulse. So remember, here's my trachea. It's right here in this groove, right in here. So I'm going to feel it, and I want to grade it. So the patient's pulse is 2+ strong. Then check the other side. We don't do both at the same time. The next thing I want to do is assess, and I can actually auscultate cardiac arteries. So I would want to flip my stethoscope to the bell, the small side. Bell is for bruits. Now I can listen over the artery here. If I hear a whooshing or blowing sound, that means they have a bruit, so I'm listening. No bruits present. Okay, the next thing I want to do is assess for JVD. The best way to do this is actually to recline your patient at a 45-degree angle and have them turn their head to the side. And what you're looking for is like right over in here, if you can see a vein sticking out, so I can shine my light from the side. And do you see JVD, yes or no? No JVD present. All right, the next part, I'm gonna assess my patient for edema. So I'm gonna show you on my wrist because I can't really get to my feet right now, but I could push over a bony part, and then I'm looking, there's no edema, there's no imprint left here. If there was, you measure how deep it is. All right, the next part, I wanna go ahead and do my heart sound. So this one, remember your favorite acronym. Mine is All People Eat Taco Meat. So we'll do that. Okay, so first valve is aortic. We talked about counting rib spaces, right? So I start under the collarbone. Here's my second rib space. So that's the first one. So on my patient, it's probably about here. So this is the second intercostal space, right sternal border aortic valve. I slide directly across. This is my second intercostal space, left sternal border pulmonic. I move down one rib space. Third intercostal space, left sternal border herbs. Down one more. This is my fourth intercostal space, left sternal border tricuspid. And then we go down one more, and this one's actually midclavicular. So this is my left midclavicular line, fifth intercostal space mitral valve. This is also the point of the apical impulse. If I wanted to listen for a minute here and count, I could, but I don't think you have to anymore. And then we're gonna flip that and go back through with the bell. So I've got to change my stethoscope. You don't have to tell me again, just show me the placement. So I'm listening, pause long enough you can actually hear. Okay, tell me your findings. S1, S2 present, no murmurs heard. The next thing we need to do is palpate the radial pulse and compare bilaterally. So when I do mine, it is on my thumb side in this little groove right here. Again, anytime we assess a pulse, we have to grade it. So is it 2+ regular, meaning it's not an irregular rhythm. 2+ is normal, 1+ is weak, 0 is absent, 3+ is like full bounding, maybe they're in heart failure. Okay, next part is dorsalis pedis pulses. I'm not going to show you on my feet, but we're going to do a little pretending here. So if this was my foot, the dorsalis pedis is kind of right somewhere near that first bone there. We're going to palpate again. Is it 2+? And then we can do posterior tibialis. That one is just behind the ankle bone. So again, if this is my foot and this is my ankle bone, it's just behind that. So reach in, feel that. Is it 2+? The last one, I'm looking at the legs and I'm looking at the hair distribution. If they have like shiny skin with very little hair, maybe they have arterial insufficiency. So just tell me if it's a normal pattern of hair distribution on the legs. The next part is gastrointestinal urinary. First thing I want to do is inspect the abdomen. So I would lay my patient flat. I'm going to look from the side to look at the contour. So you can use a pen light if you need to, but I'm looking. So this patient, their abdomen is flat. I'm looking at the symmetry. For symmetry, you look from the top, shine your light down, and you look from the bottom, shine the light up, because if there's lumps, you'll see a shadow. And I'm looking at the color. It's a normal color. All right, I want to listen to my aorta for a bruit, so I've got to go back to my bell here, the small side, and I find this part, right, this is like the costal margin, xiphoid process. It's usually on the patient's left side, just a little bit more, but if you put that right under that split, I'm listening again for a blowing, swooshing sound. A normal finding would be no bruit present. The next thing I'm going to do is listen to my abdomen and listen in the correct order. So oftentimes we have the most sounds in the right lower quadrant, so we start there. But also the bowel moves this direction. So I start right lower quadrant, I listen, then I'm going to go right upper quadrant, then I can come across to left upper quadrant, and then left lower quadrant. So I hear active bowel sounds. You don't have to say each quadrant because we just make one statement. The other thing I need to do next is palpate. So when I palpate an abdomen, I use these fingers. Kind of follow the same pattern. I'm pushing in, kind of a rotational, pushing in, okay? And ask your patient, let me know if there's any pain when I push. That would be called tenderness. So pain is it just hurts all the time. Tender is it hurts when I touch it. And I don't feel any, like they're not distended. So abdomen is soft, non-distended, non-tender. There's no guarding. I don't feel any masses, and there's no rigidity. I can also ask my patient, when was your last bowel movement? And do you have any urinary symptoms like frequency or burning? And they told me no. The next part is musculoskeletal. So we've got to inspect a major and a minor joint. So for these, major joint would be like a shoulder, an elbow, hip, and knee. So shoulder, your instructor may allow you to just have them do like an arm circle, and that's okay. But let me show you some of the motions here that you can do in case they want you to do more. So I can do abduction away from the body, right? Adduction, I bring it back together. I can do rotation, external rotation, internal rotation with the shoulder. And I can do, I always get these backwards. I think we've got extension forward, flexion backwards. But again, if you can do circles, that's easier. With the elbow, I can do extension, flexion, and you can kind of move and rotate this way. So those are the options for that. With the hip, again, I can do, if this is my hip, hip flexion, extension goes back. I can rotate it out and in. And then we could also do the knee. So the knee is probably the easiest, but you can do like extension, flexion, and you can kind of rotate just a little bit. And that's really it for those ones. So knee is really easy to get to. Minor joints would be like wrist and hands, ankles and feet. So wrist and hands, I can do flexion, extension. We can do this way, we can do fingers, spread. So again, your instructor might say you can just make circles with the wrist and with the feet and ankles or the knee, and that's sufficient. Ankles and feet, you can do, like if this is my ankle, I can push down, which would be plantar flexion, dorsiflexion, pull your toes towards your nose. We could do a circle. We can also do inversion and eversion out. So there's a lot of different things. The last part is assessing sensory function of the lower extremities. You could take like a Q-tip or something, have them close their eyes and ask them to tell you which side you're touching. You could also just touch. Sometimes in the hospital we just touch both sides and say, does this feel the same on both sides? Or you can do like, okay, tell me which side I'm touching. Left, right. You could tap both and they go both. All right, the other thing we need to do, I didn't mention with your joints, is testing symmetry. So I'm looking, do they look symmetrical? I'm palpating the joint to see what the contour is. Is it a normal contour or is it swollen? And then the range of motion I showed you. Then we do sensory function. We also have to test muscle strength. I think of this as push me, pull me. So you can put your arms up like this, push against me. Okay, good. Now pull against me. Good. You grade it on a scale of 0 to 5. 5 out of 5 is strong. Then we do the lower leg. So I would put my hand on their shin and go, okay, push or pull. You could also have them squeeze your fingers, or you could do their feet, like push down like you're stepping on a gas pedal, pull your toes up towards your nose. Any of those are fine, and grade it out of 5. The next part is gait. So I would say, okay, I want you to stand up, walk about 10 feet for me, and turn around and come back. Does the gait look steady, even, and coordinated? All right, so the last part is closure. So I'm asking Mr. Jones again, are you having any pain right now on a scale from 0 to 10? If 0 is no pain, 10 is the worst pain imaginable. Please rate your pain for me. He says 0. Is there anything I can do to make you more comfortable? No. Is the bed in the lowest position, locked, side rails are up. I have his cobble here within reach. I'm going to say, thank you, Mr. Jones, for letting me participate in your care, do your assessment, whatever it might be, do hand hygiene, and I'm done. Okay, so I know I did a little bit of teaching in there, so it took me a little longer, but about 23 minutes to get through the whole thing. So definitely achievable. I know you guys got this, okay? So good luck.